Hey y'all, it's Dr. Lakeisha Watson, an epidemiologist and data storyteller, translating data into health insights for Black women. Welcome back to Epi Fridays. Today we're talking about something that's been unfolding across the country, the government shutdown and how it's putting essential food programs like SNAP and WIC at risk. Because while the headlines might make this sound like a policy issue or a policy story, it's really a public health one. So let's get into it. As of this week, the federal government shutdown has left millions of families who rely on SNAP and WIC not knowing what their benefits will look like this month. And it's exposing just how fragile our food systems really are. Because when government funding stalls, health outcomes shift, and they shift quickly. Food insecurity isn't just about hunger. It's about the long-term health effects that follow when nutritious, affordable food isn't available. We see higher rates of hypertension and diabetes when people rely on processed foods. We see stress levels spike as families worry about feeding their children. And among pregnant women, food insecurity increases the risk for low birth weight, preterm delivery, and other complications that affect both mom and baby. And even before this shutdown, many of our communities were already navigating what public health calls food deserts, which are areas with few options for healthy groceries, or food swamps, where fast food and convenience stores outnumber fresh options. But what this truly is food apartheid. Because these conditions aren't random. They're the result of intentional disinvestment, redlining, and economic neglect that have separated Black and brown communities from the resources that sustain health. So when we talk about food insecurity in the middle of a shutdown, we're not just talking about missing meals, we're talking about the continuation of structural decisions that make healthy living harder by design. Now let's talk about food equity. If food insecurity is the symptom and food apartheid is the diagnosis, then food equity is part of the treatment. Food equity means making sure everyone, regardless of race, income, or zip code, has fair access to nutritious, affordable, and culturally relevant food. It's about justice in where grocery stores are built, which communities get investment, and whose voices shape local food policy. And from an epidemiological standpoint, food equity is measurable. We see it in lower rates of diabetes, better birth outcomes, and improved mental health when communities have consistent access to good food. I just want to, okay? But equity still operates within the same systems that created the imbalance. That's why we have to take it a step further toward food sovereignty. Food sovereignty goes beyond access. It's not just about having enough food, it's about having control over how it's produced, distributed, and consumed. It asks, what would it look like if our communities didn't just have food, but power over the food systems itself? It's Black farmers reclaiming land and agricultural traditions. It's local co-ops where neighbors decide what's on the shelves. It's community gardens, farmers markets, and mutual aid networks that say, we refuse to let politics decide whether our families eat. Food sovereignty is public health in action. It's about building systems rooted in dignity, culture, and self-determination. It's where food becomes a source of power and not stress. So as this shutdown continues, remember this. Food access isn't charity, it's infrastructure. And when that infrastructure breaks down, so does public health. But when we reclaim control over our food systems, we're not just feeding our bodies, we're protecting our futures. And if you know of any food banks, food pantries, community gardens, or co-ops in your area, drop them in the comments. Let's make sure this information reaches the people who need it most. All right, y'all, I'm Dr. Lakeisha Watson, and this has been Epi Fridays. I'll see y'all next week.